Thank you, Charlotte. Well, turning to your health, study shows that if you don't have proper transportation, it can impact your access to health care, of course. And Albaryan takes us to Watts for a closer look at the challenges many people are facing there.
I was hoping I could get it in time for the wedding.
It's about 2 o'clock in the afternoon, and 68-year-old Bill Crawford just said goodbye to his nurse who was cleaning and wrapping his stumps, part of a new normal in his life as a double amputee.
You know, I'm used to it now. I've been doing it for over 6 years now, so it's like a routine.
Bill is a diabetic who developed a severe infection 7 years ago, forcing doctors to amputate both of his legs. Seemingly small tasks like getting dressed or brushing his teeth are now a challenge. Even riding the bus to King Drew Magnet High School on Saturdays to watch the Drew League takes more time in his condition.
120th, King Drew High School.
Bill says looking back to a decade ago, before he lost his legs, he wishes he had better access to preventative care, like the clinics he used to go to at Harbor UCLA Medical Center, via a long ride on public transportation.
Ooh, say like an hour and a half, the whole process. From in front of the house here at the bus stop to the Rosa Parks station to get on the number 5. And that's the long one, right? That's about the hour, maybe 10 minutes.
He says at times, if he wasn't up for the long commute, he would miss his appointments entirely. And he's not alone. According to a study from the Urban Institute, adults who don't have access to a car are 21% more likely to forego their healthcare needs because of difficulty finding transportation. The study also finds that transportation barriers to healthcare disproportionately affect Black and Hispanic adults. Dr. Reza Babapour is a dermatologist who has dedicated his life's work to addressing the socioeconomic disparities within access to healthcare.
Mostly in South LA and East LA are dealing with chronic doctor shortages, how the inequities to this patient population often have shortened lifespan. They deal with chronic diseases. They are unable to see.
Bill says if he had more resources early on, like quicker access to his doctors, he feels he might have had a better outcome. Now he's worried that others are facing similar barriers.
Just look around in South Central. You can't find help nowhere. If you ain't got no relative or nothing that can get you there, you just not going. And it's a shame.
Underscoring the need for a better, more reliable transit system in a region that Bill says needs it most.
Thank you so much, Anna. We have